When Monique walked out of prison after serving 6 years, she was handed a garbage bag with her belongings and a bus pass. That was it. No medication for her diabetes, no mental health follow-up, no plan, just the weight of survival on her back. But a week later, she found herself sitting in a circle of women who had all been there, formerly incarcerated sisters who welcomed her with open arms. They were part of a reentry program run by formerly incarcerated Black women. It wasn't just about housing or job readiness. It was about healing, about being seen, about remembering that she was still human. Through this program, Monique got connected to a trauma-informed clinic, a community doula collective, and even a leadership cohort. She now mentors others just like her. What saved her wasn't the system. It was the community that rose up to catch her when the system let her fall. From punishment to possibility, models for change in women's health and justice. We've spent the last 5 blog posts tracing the landscape of reproductive injustice, pregnancy and birth behind bars, mental health neglect, and the painful gaps that derail re-entry for women who've been incarcerated. And now, in this final post, we turn toward hope and action. Because while the criminal legal system continues to fail women, especially Black, brown, trans, disabled, and low-income women, communities are leading the way in building alternatives that center healing, not harm. These models don't just patch holes in a broken system. They reimagine the system entirely. Community-led healing in action. Across the country, grassroots groups, often led by formerly incarcerated people, are creating bold, effective programs that meet women where they are. National Black Women's Justice Institute supports research and leadership by directly impacted Black women and girls to influence policy and shift culture. The Sista to Sista Reentry Collective in the South provides peer-led trauma recovery circles, housing assistance, and mother-child reunification programs rooted in Black feminist principles. TGIJP, Transgender, Gender Variant, and Intersex Justice Project in San Francisco is run by and for formerly incarcerated trans people. Their work includes housing, health advocacy, and direct action to end the incarceration of trans women entirely. SE Justice Group builds a network of women with incarcerated loved ones and trains them as advocates and change makers, recognizing the deep emotional and economic toll incarceration takes on families. Justice Home by Women's Prison Association, NYC, offers an alternative to incarceration model where women receive wraparound services in their communities, keeping families together and reducing recidivism. What these groups have in common is simple but revolutionary. They trust women to know what they need. They give power back. They listen.